Hi, I'm Kaylee Bear, and I'm going to explain the solution portion of our program. With the rate of maternal deaths on the rise in Somalia, we wanted to do something that would change the way that deliveries are handled all throughout the country. Education and knowledge are power, and many villages throughout the country do not have access to proper education regarding health practices. Postpartum hemorrhage is a leading cause of maternal death in developing countries. Our plan is to hold specific classes that teach women and village leaders proper techniques and information regarding childbirth. This education will happen at the village level because most people in Somalia do not live near a hospital and cannot be seen by a doctor. The education portion of our program will be split into two main parts: education on prenatal care and education on preventing hemorrhage. Our education will include information on prenatal care, proper nutrition during pregnancy, and the introduction of prenatal vitamins and iron supplements. Over half of all the pregnant women in Somalia suffer from anemia or iron deficiency. This is particularly dangerous for women in labor because it lowers the hemoglobin in the blood. Pregnant mothers need supplements and vitamins to maintain a healthy pregnancy, especially iron. There is a charity called Vitamin Angel that delivers vitamins and supplements all over the world to pregnant women in need. They could arrange to have the women in Somalia receive iron supplements they need. The next portion of our education plan will be to provide training on proper birthing practices. This will be focused on the third stage of labor, which is right after the baby is delivered. We will teach techniques in the following areas: active management of labor, cutting the umbilical cord within 3 minutes of delivery, placental delivery, uterine massage to encourage contractions and reduce bleeding, monitoring vital signs, and how to stop severe bleeding. There will always be situations where a doctor or a surgeon is needed to assist the laboring mother. Since many women in Somalia are dying because they are unable to access healthcare in emergency situations, we believe that a reliable and affordable solution is to provide motorcycle ambulances within the villages we are working with. These vehicles are low cost and will allow women to be rushed to healthcare centers when health services in the village are not adequate. We would like to implement Riders for Health, an organization dedicated to helping villagers get to hospitals during a medical emergency, as part of our program. Finally, as part of our education, we would like to send villagers to show an app we would like to send villagers who show an aptitude for medical care to midwifery or medical school. This would make an immense difference in these villages, as these professionals will return to their home villages and be able to provide medical care that they learned during their training.